body function better. Dr. Sarah Furr is with Piedmont Internal Medicine, here to talk about foods that can actually help ease our aches and pains. Good morning.
Good morning.
This is welcome advice for a lot of people who wake up and they're a little creaky and things like that. But you really are what you eat, right?
For the most part, yes.
Okay.
Yes, you really are.
So you've got some foods that can do certain things. First off, why do these foods help?
Most of the foods that we're going to be talking about today are very rich in what we call omega-3 fatty acids, or they have other antioxidants. And antioxidants in general tend to help limit cell damage and cell death.
Okay.
So
they help
promote the life
on
of
the
the
cellular
cell.
level. They help us live better, right?
That's exactly right.
Okay. Up number one, we talk about tuna. Why tuna?
Tuna is very, very rich in omega-3 fatty acids. And omega-3 fatty acids in particular have been shown to help promote good blood vessel health, help lower blood pressure.
Now tuna anyway, could you get it out of the can and do tuna salad, or do you really want to get it and put it on as a tuna steak or something
Well,
like that?
it actually does make a difference. Some tuna is better for you than others. Light tuna, canned tuna, is actually probably a better source. Tuna steak is a larger tuna, and you have to worry more about mercury levels in larger fish.
Tuna salad from the can is actually a good idea. Okay, next up, pineapple. Why pineapple?
Pineapple has two enzymes called papain and bromelain, both of which help aid in digestion, but they also break down certain proteins. So for bruising, and especially bruising, but inflammation in general, where you've overworked the muscles and you have a buildup of lactic acid, these enzymes kind of help break that down quicker.
You know, a lot of people aren't big fans of tuna for the taste or whatever, but pineapple is something that's real easy to mix into recipes and things like that.
It is. It is. So, I mean, and even with the tuna, if you don't like tuna, other forms of fish have just as much omega-3 fatty acids. Things like salmon, herring, shrimp even, but you have to watch the cholesterol.
Okay.
So,
well, a little bit.
A little bit.
Okay, finally, papaya. Now, why papaya?
Yes. Papaya, the same reason as the pineapple. It has the bromelain and the papain, which help break down the enzymes that are causing the inflammation.
So, and this is another one you can actually experiment with, because a lot of people are familiar with, you know, putting up, my wife makes a casserole, it's got a lot of pineapple and cheese and things like that. I want light on the cheese for the cholesterol things. But papaya can really add a lot of flavor into other recipes.
Oh, it certainly can. It certainly can. And none of these foods are going to actually completely eliminate any of the inflammation and the joint stiffness and soreness, but they will help.
But if you start changing that diet, not only from a calorie standpoint, but from what I'm getting out of this food, you start to make a difference in how you feel. Right?
You really do. And small changes can really start to add up and make a big difference. And over time, you can be surprised at how much better you feel.
Doctor, thank you very much.
Oh, thank you.
Makes sense. I'll tell you what, not only these three, we've actually got some more ideas on our website. You'll find it all on our morning news page. Cindy?